All right, I think it's safe to go ahead and get started. Thank you all so much for joining us today for Bicycle Health's virtual open house. My name is Kyle Young. I'm the trainer for the enrollment department, and I will be your host for the afternoon. And I, along with the other speakers of today's event, am very excited to speak with you all about Bicycle Health, the services that we provide, and the lives that we're saving every day. So thank you all so much for taking the time out of your busy lives to learn more about what it is that we do. So I would like to go over just a couple of disclosures before we get started. So firstly, please know that this presentation is being recorded for quality assurance and training purposes. Secondly, this presentation is not intended to provide any type of medical advice and is intended only to provide the public with an overview of Bicycle Health, our program, and how it all works. So during this open house, we will offer individuals suffering from addiction and their loved ones an opportunity to connect with providers, recovery coaches, and other staff of Bicycle Health from the comfort of your own home. Attendees of the event will gather information from speakers regarding program details, what Suboxone is, how it works, and the success rates of patients using Suboxone for their recovery next to other treatment methods. Attendees will also learn about Bicycle Health and our services and what sets Bicycle Health apart from other addiction clinics. So our agenda for this event is as follows. I'm going to begin by giving you all an introduction to Bicycle Health and how and why Bicycle Health was created. We also have our guest speakers, Yuri Lincheko and Peter Vrutos, to talk about how to get through the stresses of the holidays in the world of addiction. I'm then going to bring on our clinician, Sarah Purdy, to discuss telehealth and the benefits of telehealth treatment. She will also speak on Bicycle Health's clinical model. In addition, a member of Bicycle Health's care team will discuss what Bicycle Health's managed patient care looks like while being an established patient. Another topic that we'll cover is what the process looks like to enroll into the Bicycle Health program. And then from there, we'll go through a brief tour of the Bicycle Health app, where you'll be able to learn how the app works, what it does, its different functionalities, and how user-friendly it is. I'll then conclude the open house with some time from you all, with some questions from you all. If you do happen to have any questions or concerns along the way, please feel free to utilize the Q&A functionality within this Zoom meeting. And two of our senior support specialists, Gina Bompadre and Kathleen Migliazza, are with us to help answer your questions. We also have Q&A help from Sarah Purdy, one of Bicycle Health's top clinicians. If you notice the image to the right, all you need to do is select the Q&A icon listed toward the bottom of your Zoom video, and a Q&A pop-up should appear, enabling you to type. And in case you were wondering, no worries, you have the option to send questions anonymously. So why are we called Bicycle Health? Well, when our founder was developing our organization, he found a lot of similarities between addiction recovery and riding a bike. You have uphills and you have downhills. You can move slow or you can move fast, depending on your choice of speed for pedaling. Many times you start out with training wheels until you feel comfortable riding your bike without them. And sometimes without those training wheels, we fall off. And that's okay. The goal is to get back on the bike, keep going, and to not let that fall deter you from riding the bike. Bicycle Health was started about 6 years ago by our founder and CEO, Ankit Gupta. An engineer by training, Ankit wanted to create technology that had impact and meaning, and realized there was a huge need to help people suffering from addiction. At the time, fentanyl and other opioid addiction were skyrocketing, so the organization decided to focus on treating opioid addiction specifically. After spending several months connecting with people in recovery and listening to their stories, Ankit began building the Bicycle Health treatment program. So Bicycle Health began as an in-person treatment center in Redwood City, California in 2019. The first clinic had about 8 staff members and about 150 patients. The clinic was successful, but to make it even easier for patients to access care, the organization decided to start seeing patients via telehealth as well as in person. It quickly became apparent that much of the stigma that came along with addiction evaporated in a telehealth environment, and it became much easier to positively impact the lives of our patients. Telehealth made things like caring for children or an elderly loved one easier, and it also made it easier for people to stay employed and seek treatment that fit their work schedules. Travel often impacts treatment, along with privacy concerns. Telehealth, it fixes all of these issues. So what exactly is telehealth? Telehealth is the delivery of healthcare remotely by means of telecommunications technology. So I know that sounds like just a bunch of jumbled fancy words, but what that means is telehealth allows a healthcare provider to care for a patient without an in-person office visit. So when COVID-19 hit, Bicycle Health adapted to a telehealth model and never looked back. Maintaining a telehealth treatment model has been a game changer for our patients. It enables us to provide high quality treatment from anywhere in the country. In just 3.5 years, Bicycle Health has gone from 8 staff members to almost 300. We've gone from serving patients in just one state to being licensed to treat patients in 29. And most importantly, we've gone from around 150 patients to more than 30,000 patients. Our current retention rate after 30 days is 86% for insured patients compared to the industry average of 69%. Our current retention rate after 90 days is 80% for insured patients compared to the industry average of 44%. And the no-show rate for Bicycle Health patients is just 9.5% compared with a 23% as the industry average. And Bicycle Health's current age range for our patients is anywhere between 18 and 83 years of age. Bicycle Health is HIPAA compliant and is one of the only telehealth companies that employ full-time clinicians in on-call teams. In 2022, Bicycle Health was listed as one of Time Magazine's most influential companies. Our mission is to increase access to quality, affordable, convenient, and private opioid use disorder treatment for all. And our vision is to enable anyone with a chronic disease to live a healthy and fulfilling life. So as mentioned before, we are currently licensed to treat in the majority of the 50 states. So the dark orange that you see on this map, that indicates the states that we are presently active in. And we're working diligently to get the rest of this map filled up with orange. So let's get into it. I would like to introduce to you all Yerilyn Cheko and Peter Vrutos. Yerilyn is a licensed mental health counselor based in Florida who holds an EDS in mental health counseling from FAU and has over 10 years of experience in the field. Peter is a Bicycle Health recovery coach who has been in recovery himself for the last 3 decades. Peter has a great ability to build really great relationships with the patients that he works with and has a passion for helping others that are in a position that he was once in. Thank you both so much, Yerilyn and Peter. And Yerilyn, feel free to take it away.
Well, thank you so much. Very happy to be here. So yes, today I want to talk to you guys about managing stress and getting through the holidays in the world of addiction. So there are typical holiday stressors, right, that we tend to deal with. It is supposed to be, a time of like happiness and, positive emotions and family gatherings. But the reality is that that is not true for everyone. And so I want to talk to you about different triggers and stresses that you may experience or some that are typical. So during this time, we will see increased stress because of family gatherings. And so whether you have too big of a family or too little, it may heighten certain feelings. So if we have too little of a family, it may highlight feelings of loneliness. And if you have a big family, what may happen is you will have more gatherings, more events, more having to be with your family. And if there are unresolved conflict or issues, just may make it very stressful to deal with the situations. There's also the financial pressure, right? During this time, we're expected to host events, to buy gifts, to decorate, to cook, right? And all of that takes well, money. And so financial pressure tends to be the number one reason why people report feeling very stressed during the holiday. There's also expectation. So if you look at a Christmas, not any holiday movie or commercial or social media, everyone looks like really happy and like everything's fine. And if that is not your reality, that may prompt some internal turmoil, and rightfully so, because it just doesn't look like that for me. So it may be almost like a reminder. So having the appropriate coping skills, which is the next one, is really important. So not having a healthy coping mechanism to deal with stress will heighten symptoms. So symptoms of anxiety or depression tend to be reported. About 64% of adults tend report experiencing heightened stress during the holidays specifically. And so if we're not well prepared, it would just put you in a very difficult place. There is also social pressure. And we talked about family gatherings, but there's also social expectations, whether it's at work. If you go and you have to buy, let's say, presents, there's lines, traffic, just a lot of opportunity for more social anxiety. And if you have to go to gatherings, whether they're work related or family related, there may be opportunity for temptation there. There may be alcohol and other substances present. And so it just puts her in a very difficult spot, and we have to be ready to deal with that. As far as grief or difficult feelings during the holidays, we may have this created a fantasy of what they're supposed to look like. And so it may highlight unresolved conflict with family members, loneliness, intense emotions, or unresolved wounds. And people tend to report feeling more sad during the holidays because it may not look like what it used to look for them before. So, for example, when I was 5 or 6 years old, my family was all together. Now the reality is they live in separate states and I don't get to see my family every holiday. So it may just highlight some of those difficult realities. Okay, so now I want to talk to you about what can we do? What are some coping skills that we can put into place to make sure that we are managing stress and that we are able to effectively or to stay in recovery? So the very first thing I would say, the most important, is to have a plan in place and set very realistic expectations. Have a plan for, whether that is checking with your recovery coach, whether that is checking with your sponsor, with your therapist, attending groups before going to an event. So feeling prepared to deal with the situation. And so if we are prepared first, it will set you up for a more easier situation or time. The next thing will be to stay connected, especially to your friends and family and people who support your recovery. This is a really good time to make sure that you're regularly checking in with your coach, with your therapist, with your sponsor, and attending, like I said before, attending those groups just to make sure that we are prepared. And we have to absolutely prioritize self-care, whether exercise, sleep, anything that will help you feel physically better will equip you to deal with emotional or difficult situations in a much healthier way and more effective. The next thing would be mindfulness, whether it's creating a gratitude journal so that you can focus on the positive things that you have. Practicing mindfulness, things like meditation or yoga, are very effective in helping you be ready to handle stress. So those two techniques have been reported to be very effective, and it helps you ground yourself and center yourself so that you can focus on the things that are important. The next thing is to have an exit plan. So if you may find yourself in a situation that is triggering, how will you go about exiting that situation and not putting yourself in a place where you feel even more comfortable after the fact, right? So having an idea of if this happens, this is how I'm going to exit. And the more prepared again you are for that, the less uncomfortable you will feel. And then finally, seeking professional help. It is okay to ask for help. And these situations, sometimes we can't handle all on our own. And we have therapists, We have recovery coaches and people that are equipped and are able to help you develop the skills necessary to manage not only stress, but to help you stay in recovery and to also help you cope with mental illness and symptoms of mental illness. So I would say those are the best, or some, because there's obviously a lot more, but some of the top coping skills that you can use during the holiday season to feel a little bit more at ease. Are there any questions? For Peter, did I miss any?
Actually, no, I do have a question now that we're talking about it. And there's some people who are in attendance who may not have started their recovery yet. Maybe they set it up as a New Year's resolution. Should they wait?
Ooh. Oh, there is no time like the present. And what better way to start the year than in recovery and in feeling healthy? I would say people tend to think, well, the holidays are a happy time, so like we'll start next year. I would say the holidays is the best time to start, because then not only are you giving yourself the gift of recovery, but also you are now entering a new year feeling good about yourself, feeling good about your recovery. I think it's the best time, is the present.
All right, thanks, Yerlin.
Of course.
So my name is Peter Vertos. I'm one of the recovery coaches here at Bicycle Health, and I want to start off by saying thank you for coming. I am 3 decades into my recovery, and so all the coaches on our program have lived experience with addiction. When you complete your first appointment at Bicycle Health with your provider, you'll find Bicycle Health has a wealth of support for you. The recovery coaching program is a place where you can plug in and get vitally needed support and information as you begin your journey. I know some of you may have lived with, the stigma and shame of addiction. You will find no judgment from us. In our groups online, you'll feel really comfortable. So they are online. You don't have to worry about running into a neighbor or a coworker there. When you arrive to your first peer support group, you'll quickly see 2 things. Number 1, you're not alone. And number 2, success is possible. You'll get to meet our team, who, as I mentioned earlier, are all peers in recovery, and you'll meet recoveries. Right now, we have dozens of groups throughout the week, so you're never too far from having a place to connect. And our groups do break down to a few different types. We have general groups where it's just a good place, as I said, to connect and hear from your peers. We have community groups that are a little more specific, like the men's group and the women's group and parenting group and early recovery group. Then we have educational groups where you'll learn things like the science of addiction, self-care, mindfulness. We have activity groups like journaling, where we work on getting into the practice of journaling and talking about all the advantages it has and what it adds to your recovery. Then as needs arise, like the holiday season, we're putting together some programming. We're putting together programming to specifically address what Yerlin was talking about, all the stresses that come along with the holidays. At the start of your recovery journey, there may be some challenges you're having, and it's just really valuable to have a place to bring all those problems and questions. In some cases, maybe you heard some bad information about treatment. Maybe you want some help setting up some realistic, goals. By attending groups, there's a place to come and learn, to understand how to be patient, to get a place where you can work on your recovery and enjoy really long-term success. Commonly in the groups, we talk about things like overcoming temptation, understanding triggers. You get to hear strategies on your recovery, not just from us coaches. You get to hear it from your peers too, because we have some people who have like an enormous amount of time in, and hearing how everybody's overcoming their situation is really valuable. And then groups are a really great place to come in and celebrate your victories. Oh geez, I got 7 days, I have 30 days, I have 100 days, or maybe I got myself straight enough where I can get a new job, or I'm buying a new car, or whatever it is you're celebrating. It's really important and motivating. And over time, our patients all become invested in each other's success. By engaging with the recovery groups, you'll have additional points of contact within Bicycle Health. If you're feeling bad about something that happened, our groups are always a friendly place to, talk through those things. So maybe you're not a group person, maybe you're a little shy. We also have one-on-one coaching that you can use. Sometimes there just may even be some issues that you may not want to talk to in front of a group. And that's okay too. The one-on-ones are for that. And we usually run them along a few different tracks. When someone's starting out and they're having some struggles, getting rolling, great time to plug in with a coach. When somebody's having very specific challenges in life or a crisis they're overcoming and they're trying to avoid temptation, sometimes life deals you some bad cards and you may need a coach to help work you through those. And then sometimes we're doing really well and we want to sit down with the coach and maybe get some advice or feedback on kicking things up to the next level, tackling some bigger goals that we have. Recovery coaches can also help patients find outside resources. We could remove barriers for their from their recovery. So it's just good to have people to touch in with. There's a lot going on in this world as you're getting started, as you begin your journey. So having multiple touch points here can make a huge difference. Finally, some people start out with Bicycle Health and they might not realize or not be ready to realize their addiction is actually the symptom of something deeper. In engaging with recovery coaches, we may surface something that's going on that at a certain point, maybe we need a little therapy for. And Bicycle Health does have a whole team of therapists that can help you as well. Here's what we know. Our providers are great. They do a great job with our patients. But the more services that people engage with when they come into Bicycle Health, it increases their statistical probability of long-term success. So with that said, as you're getting started, definitely want to get to know you. We want to help you out and we want to see you win. So with that said, I will kick it back to Kyle and I'm looking forward to seeing everybody soon. Kyle.
Hey, thanks, Peter and Yerlin. We really, really appreciate the work that you both do and the information that you were both able to provide. So thank you again so much for that. I would now like to bring on one of our top clinicians, Sarah Purdy, and one of our senior clinical support specialists, Gina Bompadre. Sarah is going to speak about our clinical model and touch on what Suboxone is and how it works. And then Gina will take over and she'll be speaking with you all about what it's like to be an established patient with Bicycle Health. So without any further ado, I'd like to introduce to you all Sarah Purdy. Hi, Sarah.
Here.
Yeah.
Every time I enter a visit with a patient, I'm just grateful you're here. And everyone you're going to talk to on your journey is just happy that you're here, however you come. Some people come to us first experience, right? We're transitioning from old to new. Some people come to us as a transfer. You're already in your recovery. You know how it goes, and we're just here to help guide you further. Or maybe you're a provider, emergency room, a facility that has patients that need help. And where can you send them? We handle all of those avenues to get to success and recovery. So I am one of the medical providers here. I'm a physician assistant and we work in teams. You're going to have amazing people here. So how does it work? Our medical model is very unique. So we specialize in opioid use disorder using medicated assisted treatment. Now, medication, there's many different types of medication that can be used for this specific thing. We focus on Suboxone is a brand, generic is buprenorphine and naloxone. Now, we talk a little more, what is it? What does it do? So whenever anybody takes an opioid for any reason, it's going to go into the brain. And I have a needy cat. You'll have to excuse me. She's creeping up here. Anything that goes into the brain becomes difficult. It messes with things. So it attaches to a mu receptor in the brain. Now, it's a full agonist, the opioid. So what buprenorphine is going to do, it partially activates or a partial agonist to that same receptor to stop the withdrawal effect, tolerance, and cravings. Now, some people may have heard of, say, methadone. It's another avenue of medicated assisted treatment. That's a full agonist. It's going to pop on the entire receptor. Used differently, there's pros and cons to that. And then there's buprenorphine only, sometimes called a mono product or Subutex. It has a purpose. Online, we specifically use Suboxone, which has the naloxone, which is an overdose protector. Everything we do here at Bicycle is all for safety and success. So when anyone takes an opioid for any reason, doesn't matter why, how, it attaches that new receptor in the brain, right? It's going to do its job and wear off. Now, we don't know whose receptors are then activated and they don't shut off. That's what that you start to feel sweating, nausea, vomiting, from slightly uncomfortable withdrawal symptoms to just horrific stories. It just feels awful. So what we do, if that's the case, the buprenorphine, kind of like a hole in a boat, is going to partially activate to stop those symptoms and then go through the journey of where do we go from here. Buprenorphine, it's a safe at-home transition from an opioid to at-home buprenorphine. We also have people who come to us that we continue care, and it's something that we can get started safely at home. On the slide, you're going to see a disadvantage of potentially long-term medication, but we talk about that. Everyone's journey is unique. We talk about your short-term plan, your long-term plan, and what does that mean for you? So everyone's journey is very different when it comes to duration of time. So the steps that we use, depending what part you come, right? Are you feeling your worst at the moment, right? We're going to take you quick and do an induction. What induction means for us is transferring you from whatever opioid. We don't judge. We talk openly about it to get you to the buprenorphine type product. Or are you coming to us on a maintenance? Maybe you're in your community, in a program, but an at-home telemedicine program might give you more flexibility to do certain things in life. We bring you on and we continue. Or are you being referred from a crisis center, a rehabilitation center, from an emergency room? Still, we'll get you where you are and then we continue. So 3 phases that we look at, what we call induction. Are you needing to transition from opioid to buprenorphine? We go through all the details. You have 24-hour access on our Bicycle app to message your provider, if it's me or your wonderful care team, along as your recovery coach. So there's always somebody available to help go through this, challenging first step. I always say it's the hardest part. Once we get past that induction, it does get much, much better. We also discuss comfort meds. We do provide other medications on a case-by-case basis to make this as comfortable and safe at home. The maintenance part, so I always say that's the hardest part. We got through that induction. Then we talk maintenance. What is the lowest amount of that buprenorphine to fill the receptor that's going to give you that quality of life? Short term, and then we go through and maybe we wean, we reduce, we go through a plan of long term. We're monitoring the dose. We're making sure, how are you feeling on it? How is it working for you in your life? Are you working 12-hour days in a factory and we need to work on split dosing? How is it working for you? We talk about our at-home urine drug testing. It's safe, it's private, it's all done privately through the app. We go through how it's done to make sure you're comfortable with it. And during the maintenance phase, now that's the ongoing. We bring in our recovery coach services. We bring in other care teams. What's happening in your life? What is it that we can help with? We have services that people need, but we cater it to where you are. As a provider here, we do mental health assessments. We're able to do mental health medications that can be used commonly short-term and long-term during this transition, depending on where you are coming into us. And the last part, it shows their tapering. We stress it's not a cookie cutter program. When you met Peter, when you first came in, he talked a lot about we rally behind our patients as a team. We're going to get to know what's going on, what's going to work best for you, where can we offer services. Same with the tapering process. Not 2 journeys are the same. We're always going to continue to reduce. What does the body need at the moment? Do we need to go up? Do we need to go down? And what's happening in that time to try to get long-term success? And that long-term success means something different for every patient, but we're going to create that and go over it with you together. So, and what makes it very sustainable and successful is it's all online. I always tell, if you have internet and a smartphone, you literally have a massive amount of a care team at your disposal to be able to get you where you want to go. You don't have to go drive to and from and park and snow and rain and kids and work and you name it, all the things that we have to do. Pets, people, you got a phone, you can see us. You can go on the next slide. So meaning our medical model has proven through the woes of COVID and post that it is vital, beneficial. It works. Our patients love it. We're changing lives. So in how we do it is very unique. We'll take you through each step. Once you come to us, we just take you in, get to know you, and how can we get you where you need to go very safely. So once again, I'm Sarah Purdy. I'm one of the providers since the beginning of Bicycle. I love what we do, but everybody you meet loves what we do. So if you have any questions toward the end of it, you can feel free to type them in. Or even there's information how to access us after these type of presentations, to just let us know what you need, what you're thinking, and we'll gladly give you as much information as we have. So thank you all very much. I'm gonna tee it back over to Kyle and continue our amazing presentation.
Awesome. Thank you so much, Sarah. So up next, I'd like to introduce to you all Gina Bompadre. Gina is going to speak with you all about what it looks like when you are an established patient here at Bicycle Health. Go for it, Gina.
Thanks, Kyle, and thanks everybody. Just to follow along everybody else's sentiment, thank you so much for being here, taking your time to learn about us and our program, the great things that we can do for our patients. As Kyle mentioned, my name is Gina Bompadre, and I am a senior clinical support specialist in the West region for Bicycle Health, and I've been here for 2 years. Our patients are able to live our lives by going through a program like this. They can maintain employment. I've seen them get promotions, rebuild relationships. Having this program via telehealth like we do allows you as a patient to have your appointments in the comfort of your own home with your cat right next to you, as Sarah demonstrated, at the times that work best for you. Now, MOUD, which is medication for opioid use disorder, it's not only about the medication. It involves treating the whole person, which also includes our mental health, just like Yearlyn and Peter and even Sarah mentioned. Because of this, you do have access to that one-on-one therapist, to group therapy, the peer-led support groups, and care coordinations. And some of us, we've actually been there where you are, and some of us were on the outside looking in. So if you're not comfortable talking one-on-one, the support groups and the group therapy sessions are just an amazing place to sit back and listen. There's so many different groups, all walks of life, so many different times of the day and week to fit your needs. And every single person has their own story, and it might resonate with you. Your story might actually help someone also. So we do recommend that you try at least one. You might just find it helpful. And there is a quote that I have seen before, especially kind of this holiday season, families, relationships, and things like that, that I think is super important from our therapy team. And it says, rebuilding damaged relationships or making healthy new ones can be very helpful in recovery. And our recovery support programs can help you do that. And I firmly believe that also, and I've seen it firsthand. Now, after you've enrolled into the program, you have your first appointment scheduled. You are going to get a link to download the Bicycle Health app on your smartphone. This app is the only thing that you need to have your appointments and to reach us, your care team. Now, behind the scenes, we, as the clinical support specialist, we're calling your pharmacy. We want to make sure that they have stock in your medication so that your transition into our program is as seamless as possible. So by doing this ahead of time, it prevents a delay in your induction and also reduces the time kind of going back and forth with your care team. So you've had your first appointment. You did it. Congratulations. We're so proud of you. We know that was a huge step that you took, and your provider went over with you during your appointment how to start your medication and likely gave you an induction plan also to reference. So if you have questions about this or anything really, the app is the place to reach us, the clinical support specialist, your care team, whatever you want to call us. Have you ever been to a doctor's office? You walk in, the nurse or the medical assistant calls you back. They ask you a lot of questions, get your vitals, etc., and then pass you off to the provider. Well, that's who we are. Every patient is assigned a care team, and we can help with 90% of whatever you need. Once you're established, we can help you schedule follow-up appointments. We can check different pharmacies. We can address any prescription issues that you might have. If you need treatment verification letters for a job, for example, we can take care of that for you. You have questions about urine drug screen, we can help with that also. If you move, have a new phone number. If you have questions about your medications, just the list goes on and on. Of course, if we do need to reach out to your provider for any urgent medical issues, we absolutely do that. And you also have access to reach your provider as well. Now, if your provider happens to be out of the office, we also have on-call providers and covering providers there that are available as well. So while we are behind the scenes, we are also here to support you. We want to listen to your concerns. We want to celebrate your successes while also holding you accountable. This is your program. This is your recovery, and we are here for all of it. As I mentioned before, your care team, we're not only the medical personnel, but we also have a highly innovative tech support and engineering team that's always looking for ways to improve your overall app experience. This is the age of technology, so things happen, right? This highly skilled team is here to help resolve those unforeseen tech issues and get things back on track as quickly as possible. We also have a dedicated financial management team, whether you are self-pay or an insurance patient, to make sure that your billing is accurate and as painless as possible. We do understand things happen, life comes up. So when you reach out to us in the app, we are able to send requests to the finance team, like changing billing dates, for example, or any other financial related issues or questions that you might have. Now, as I said before, our tech team that comprises the product and engineering departments are always trying to find the new ways to make your experience better and easier in the app. So we have recently launched several new features to the Bicycle Health app that enables established patients to complete tasks like rescheduling your upcoming appointment if it doesn't work for you. Having this feature allows you to be able to reschedule for a time or date that does fit better into your busy life. Now, some other features that include an easy to resolve past billing issues. If something like that happens to come up, there's a spot in there now for you to be able to take care of that on your own, as well as completing release of information forms. If you want your records sent to a new facility, or if somebody else is requesting your records, all of that is now simplified and very straightforward. Having these tasks at your fingertips allows for continuation and coordination of care without the usual to sharing the latest and greatest improvements our amazing teams are working on to make your experience with Bicycle Health the best that we have to offer. Thank you so much for joining us, and I'm going to give it back to Kyle.
Awesome. Thank you so much, Gina. Next, we are going to have the fabulous Robin Carter go over Bicycle Health's enrollment process and talk about how easy it is to join the Bicycle Health program. She's going to go over the different options we have to enroll into the program, and then we'll go over the additional steps needed to become an established patient here at Bicycle Health. So just as a reminder, after this portion of the event, we are going to be going over a brief demonstration of the Bicycle Health app, and from there, we'll be opening the floor to you all for a live Q&A session. So again, if you have any questions, feel free to submit them now. And in the meantime, feel free to take it away when you're ready, Robin.
Thanks, Kyle. Hi, everyone. Like Kyle mentioned, my name is Robin. I am one of the senior enrollment coordinators here at Bicycle, and I've been with the company for 2 years now. And I just want to go over the enrollment process with you all. So to start, we have multiple ways you can choose from to enroll into our program. From our website, you can actually find a chat functionality that will connect you with one of our enrollment coordinators, and they'll walk you through the entire process. Also, from our website, you have the ability to go on and schedule the perfect date and time for one of our coordinators to reach out to you, or you can choose to enroll through our self-service option, which would involve you filling out an intake on your own and having an enrollment coordinator reach out to you once completed. Or you can just call directly into our phone lines. Once you connect yourself with an enrollment coordinator, the coordinator will introduce themselves and go over program information, as well as answer any questions that you might have. They'll speak with you about our $199 monthly rate, which covers all doctor's visits for that particular month, access to online support groups, access to a care team, and all of your urine drug screening kits. Once questions are answered, the coordinator will go through about a 10 to 15-minute health questionnaire with you. This questionnaire will help us gather basic information, health information on you to determine if Bicycle Health is going to be a good fit for you and you'll be a good fit for Bicycle Health. Of course, all information gathered will be kept completely confidential. During this questionnaire, the enrollment coordinator will also go over billing options with you, such as if you have insurance or if you're going to be self-pay. We are able to accept many commercial insurances, and in some states, we're able to accept Medicaid and/or Medicare. Once the questionnaire is completed, the enrollment coordinator will electronically send you the paperwork that will need to be completed via text message or email. These are going to be standard forms that you'll fill out when you go to any kind of doctor's office. There's a consent to treat form, a financial agreement, as well as a couple HIPAA forms to fill out as well. You'll also upload a photo of your ID, and if you're paying for treatment with insurance, you will also upload an image of your insurance card. At the time we receive your completed paperwork, we can then get your appointment scheduled. We'll first book your initial appointment. This appointment is going to be an hour-long slot, so you do want to keep that in mind. After we book your initial appointment, we'll then book your 20-minute follow-up appointment. This appointment is simply so that your provider can check in on you, see how you're doing, feeling, things like that. Your follow-up appointment will be scheduled anywhere between 2 to 7 days from your initial appointment. Alrighty, so now that appointments have been scheduled, your paperwork will go into processing. Our enrollment team will assist you through the registration process and ensure that everything is set up for your first appointment. Once our team is finished processing all paperwork, they'll go ahead and send you the Bicycle Health app to download onto your phone. And all you'll have to do is just wait for your appointment date and time.
Awesome. Thank you so much, Robin. We here at Bicycle Health, we certainly do our best to make joining our program as easy and seamlessly as possible. So before we start taking questions from you all, we are going to hear from Kathy Migliazza, and she is going to take the next few minutes to give you all some information in regard to our app and how it works. You can hear about its functionalities, its simplicity, and just how easy it is to navigate. So thank you so much, Kathy.
Awesome. Thank you, Kyle. Hi, everyone. My name is Kathy Migliazza, and I am a senior clinical support specialist in the Southeast region. I've been here at Bicycle Health for the last almost 3 years now. It's been such a pleasure to work with our providers, our clinical team during this time, but more importantly, it's getting to work with you guys, our patients. You all inspire me, and it's been such a wonderful experience having a hand in changing your lives. So thank you so much for letting me be a part of it. Now let's talk about how user-friendly the Bicycle Health app truly is. Congratulations, you are now enrolled. Like mentioned before, our enrollment team will help you get the app downloaded for you. Once completed, you will open the app and click on I'm new to the app and follow the instructions to get started. If you have already done this, you can click on log in. After you have logged in, you will see that second image here, which is called your home screen. This will have your name at the top and any upcoming UDS tasks and when your next scheduled appointment is. This image shows that this patient has to complete a UDS screening due. When you get this notification, you will need to complete it within 24 hours of that request. You will click here and it'll give you step-by-step instructions on how to complete your UDS test and upload your pictures so that way your provider can review them. You can also see here that when the next appointment is scheduled for as well. Before we get into all this, let's review that lower right-hand corner button that says chat. All right, so here are your chats. It's important to know that we are a live two-way chat and when our operation hours are. We are open Monday through Friday, 9 a.m. to 10 p.m. EST. Your two-way chat is the clinical support staff chat. And this is where you will get the most information, questions answered, and quickest reply from. You can ask us about insurance, UDS questions, prescription, pharmacy issues, and more. This is really your one-stop shop to get all of your questions answered. The other 3 chat channels are for information and update purposes only, which are not monitored. The lower left-hand corner icon where the paperclip is where you can attach any pictures, notes, documents, anything else that you're wanting to send to us as well. Such as in the second picture here, it's an example of a patient asking to add their new insurance card to their file. These chats are our primary form of communication whenever you need it. We are always here and will quickly reply as soon as we can. All right, it is almost time for your first new patient appointment with your provider. You're going to click on that lower left-hand button that says appointments, and you will see this screen. About 5 to 10 minutes before your appointment start time, come onto the app and click join. This will be a bright green color when it's ready for you. Your provider will meet you there when it is time. Some helpful tips to ensure that you are ready for your appointment is to locate yourself in a quiet space, have your volume on high or feel free to use headphones, make sure you have a strong Wi-Fi connection, and then test your microphone and camera to ensure that you can hear and see your provider as much as they can hear and see you. The quicker you have these things done, the much smoother your appointment will start. If you do run into any technical issues, you can always message us in those chat channels that we just displayed earlier. All right, now you completed your first appointment. Congratulations. After your appointment is done, please wait up to 1 hour before checking your Bicycle Health app again and click on the bottom button down there that says medications. Here is where you're going to see your prescriptions your provider just sent over for you and where you can pick them up from. Please make sure to call your pharmacy before making the commute over there to ensure that they have received it, it's filled, and it's ready for you to pick up. If you run into any issues at all, please reach out to us in the chat. Finally, the last thing is that you can click on that bottom right-hand corner where it says resources to find plenty of other helpful information and FAQs. Now I will hand it back to Kyle to go over any questions that you may have. Thank you so much.
Perfect. Thank you, Kathy. Our engineers have worked really, really hard on making this app as user-friendly as possible. And thank you for sharing that information with all of us. All right, we would now like to spend these last few moments being able to answer any questions that you folks may have. So if you do have any questions, post them in the chat, and our team's going to do our best to provide you with all the answers that you need.
All right, so it looks like we've got our first question in. How do I know my information is protected in the support groups? Is there an option to be anonymous? I am actually going to pass this question over to Peter. Peter, if you'd like to jump in on this question, I know you run a lot of our support groups.
Yes, I do. So first thing is you can enter the group with just your first name and your last initial. The only thing is you will have to identify yourself to the coach, so we are certain that you are in fact a Bicycle Health patient and you belong there. And as you're beginning, if you come into a group and you're not quite ready to share yet, or you feel a little bit shy, you can even come to the groups just to listen, for a little while you're getting comfortable. But ultimately, we want to hear your voice. But it's okay if you just want to listen for a while. I hope that answered the question.
Awesome. Thanks, Peter. We've got a couple more questions rolling in here. The next question, how long will it take to complete the Suboxone treatment? I am going to pass this one over to our clinician, Sarah Purdy. Do you want to go ahead and take on that question?
So yes, it varies. Everyone's journey is very unique, right? So we look at, is this somebody who got hit by a car at 16 and had been on opioids for decades and now we're transitioning? Is this somebody who had a C-section a year ago and was given hydrocodone and we can't get off of it and we've been using it for 6 months? So everybody's journey is like a snowflake. No two snowflakes are the same. So we're going to look at what your journey is. What was the type of opioid, long acting, short acting, multi different things to see what your body needs. We're going to give your body what it needs with the buprenorphine. And then we're going to go through what does the wean, attempt, and taper program look like. So it's not long-term for everybody. Look at diabetes, right? Look at blood pressure, look at other medical conditions. They all vary with all varied factors in your care. So meaning just know we're not going to put somebody on something and expect you to be here forever, right? Is your course going to be long-term, short-term? But we're always going to go through what that looks like for you and your specific plan. So that's probably the easiest way to put it is it varies uniquely per each person. So I hope that kind of helps. And I'll take this other one that I see here. Will Suboxone help with pain? Because I get that a lot, and that's okay. I tell people, ask me anything. It is okay. So let's break it down. What is Suboxone? What is buprenorphine? What is it attaching to, right? So the opioid goes to the mu receptor, attaches the whole thing, right? Buprenorphine, partial agonist, partial attachment. So Suboxone, buprenorphine, methadone is not FDA approved for pain. However, it's acting on that same pain receptor at a partial level. So some patients report when we do the transition that it does have a benefit of some pain component, some pain control. We cannot use it for pain control. However, some patients are very pleased to report, wow, it is doing other things that it can do through the chemical pathways that it's operating on that same receptor. So yes, some people say it does help for pain, but we're not expecting it to be full pain control, if that hopefully answers that question. I'll hand it back to you.
Thanks, Sarah. That was super helpful. I can actually take the next question. How long will it take to get a first appointment with Bicycle Health? So the initial intake of a patient typically takes place on the same day as when the patient first contacts us. An enrollment coordinator will work with the member to get an appointment to see a provider, usually within 24 to 72 hours after the intake. But our goal is really to see at least 70% of patients within 24 hours. All right, let's see what our next question is. Do I have to be in withdrawal before my first appointment?
I'll take it. I'll just say get to us however, whenever, it don't matter. We're going to work with whatever you come to us at, if that makes sense. Come tomorrow, come now. We're going to work through that with you. Timing. So just come however you come, and we're going to make it better for you. I'll put it that way. All right, so I think we have time for one more question. So this will go ahead and be the last question of the night. How often do you guys do these open houses? We do try to hold them at least once a quarter. Each open house is recorded, and we do upload them onto our YouTube channel. That way you can view any past open houses, and you can also send them to a family member or a friend for them to view as well.
Awesome. Thank you so much, guys. All right, folks, our time has come to end our open house. So if you do have any further questions after we get off here, you can send all inquiries to openhouse@bicyclehealth.com. And we'll respond back to you as soon as we can. And just again, that's openhouse@bicyclehealth.com. If you are interested in enrolling into our program, or if you know anyone that would be interested in our program, you can also give us a call at 844-943-2514. And again, that's 844-943-2514. You can also visit our website, bicyclehealth.com, where you can review the other enrollment options that we spoke about, such as our chat enrollment. There's also loads of information on there, different articles that you can read to educate yourself on some things if that's what you're looking for. So I do encourage you to check out bicyclehealth.com. I would like to thank you all so much for taking the time to learn about Bicycle Health and what we're all about. I would also like to thank everyone involved that assisted with putting this event together. Thank you all for all that you have done and for your hard work and dedication to make sure this got put on. Have a fantastic rest of your day, everyone. Be safe, and thank you so much for your time. Bye.